All right, so you're ready to dive into the California workers' comp system. It might not sound like a beach vacation, but knowing this stuff can be a lifesaver, if you ever get hurt on the job.
Yeah, it's definitely one of those things you hope you never need, but good to have in your back pocket just in case.
Exactly. And today we're using this text as our guide, specifically chapter 6.
It's all about, well, it focuses on the role of physicians in the California workers' comp system.
Doctors everywhere. So let's start with the basics, right? Who are the main players you're going to encounter in this system?
Well, the one you'll be seeing the most is your primary treating physician, or PTP.
PTP, got it.
They're kind of like the quarterback, the main doctor in charge of your treatment.
So they diagnose your injury, figure out what treatment you need and all that.
Right. And they also decide when you're ready to return to work.
Oh, wow. So their reports are super important, right? They basically determine if you get benefits, how long you can stay off work.
Absolutely. The reports go to the insurance company, the workers' comp board. It's all based on what they say.
Okay, so that makes me wonder, can I, choose any doctor I want to be my PTP?
Not always.
Yeah.
California has these things called medical provider networks, MPNs.
MPNs, what are those?
Basically, it's like a list of doctors approved by your employer.
Oh, so if my employer has an MPN, I have to choose a doctor from that list.
Yeah, that's usually how it works.
Yeah.
And for that very first visit, your employer actually gets to choose the PTP from the MPN.
Wait, seriously, I don't even get to pick my own doctor for the first visit.
It can be a little frustrating, yeah. But there is a way around it, something called a pre-designated physician.
Pre-designated physician. Okay, tell me more about that.
So if you meet certain conditions, like having employer-provided group health coverage, and you give your employer a written notice before an injury happens.
Oh, so you have to do this ahead of time.
Right, it's like planning ahead. But if you do that, you can actually pick a doctor outside the MPN.
Okay, so having that pre-designated physician in place can give you more control, which makes sense.
Exactly.
Now, what if I need to see a specialist? Like if my injury is more complicated?
Those are your secondary treating physicians.
Got it. So if I hurt my back, I might see an orthopedist or a physical therapist.
Yeah, something like that. But those specialists, they report back to your PTP.
So the PTP is still the main point of contact, coordinating everything.
Exactly. And ultimately, it's the PTP's reports that carry the most weight in determining your benefits, your recovery plan, all of that.
Wow. Okay, this is making me realize how crucial that initial choice of PTP is.
Oh yeah, it's a big decision. You want someone who not only knows how to treat your injury, but also understands the workers' comp system inside and out.
And who will fight for me, right? Someone who's a strong advocate.
Absolutely. You want someone who's on your side, who's going to make sure you get the treatment and support you need.
Okay, so finding that right, PTP is priority number one. But what about all those regulations and rules we were talking about?
Ah, yes, the fine print.
Yeah, you mentioned some eyebrow-raising ones earlier.
Well, one thing California takes seriously is making sure doctors aren't making decisions based on, their own financial interests.
That makes sense. Keep things ethical.
Right. So they have rules against, for example, self-referrals.
Self-referral, meaning referring a patient to their own clinic or something.
Exactly. Like imagine your doctor owns a physical therapy clinic and they refer you there without mentioning, that they own the place.
Ah, okay, so that's a conflict of interest.
Right. And the system's designed to prevent those kinds of situations.
So the idea is to protect the patient, make sure they're getting the right treatment for the right reasons.
That's the goal.
Okay, what else should I be aware of? Are there any other surprising rules or regulations?
Well, another thing to keep in mind is that you might not always see the doctor directly for every appointment.
Huh, really? So who would I see?
Sometimes you'll be seen by a physician extender, like a physician assistant or a nurse practitioner.
Oh, okay. So can they, make decisions about my case? Can they say whether I can go back to work or not?
They can definitely manage your day-to-day treatment, check on your progress and things like that. But the final call on things like your disability status, that rests with the supervising physician.
So even if I'm mostly seeing a physician assistant, the doctor is still ultimately in charge.
Exactly. It's
Yeah.
a team effort, but the doctor's the one who signs off on everything.
Got it. So always good to know who's calling the shots, right?
Absolutely.
Mm.
Right. They're ultimately responsible. And, oh, we can't forget about QMEs.
QMEs. Oh, yeah. Remind me what those letters stand for.
Qualified medical evaluators. They come in when, if there's a disagreement about your diagnosis or treatment or, how disabled you are from the injury.
So they're like the referees, making sure everything's fair.
Yeah, exactly. Let's say you and your doctor think you need surgery, but the insurance company says no.
Ah, I see where this is going.
That's where the QME comes in. They can give it like an unbiased evaluation.
So it's not just one side's word against the other.
Right. It's an independent opinion.
So how do they choose this QME? Is it like random?
Well, if you have an attorney, you and the attorney can like agree on a QME from a list.
Yeah.
But if you're representing yourself,
Okay.
the state will randomly assign one to you.
Okay, so it's like fair either way.
Right. They try to keep it unbiased. And the QME, they review your records, they examine you, and their report is like really important.
Wow, so they have a lot of power in the case.
They do, yeah.
Okay, QMEs, got it. Now, you keep mentioning disability. What exactly does that mean in like workers' comp terms?
Disability basically refers to like how much your work injury is limiting you, you know?
Like if I can't do my job anymore.
Right. Or even if you can, but you have a certain restrictions.
Okay, so it's not just about whether you can go back to your exact same job.
Exactly. It's about, any limitations you might have because of the injury.
Got it. So is it just a doctor saying, yep, you're disabled, or is there an actual process?
Oh, there's a whole system for figuring out how disabled you are.
Okay, because that obviously affects like how much you get in benefits and stuff.
Right. It all ties together. So your PTP will assess things like, how well you can move, your strength, pain levels, even how it affects you mentally.
Oh, wow. So it's not just the physical stuff.
It's the whole picture. And based on that, they give you a disability rating.
A rating. So is it like a scale of 1 to 10 or something?
It's a little more complex than that, but basically the rating determines how much you get in benefits.
Mhm.
If you need job retraining, all sorts of things.
Wow, this disability rating is a big deal.
It is, yeah.
So what if I like disagree with the rating my doctor gives me? Can I challenge that?
That's where those QMEs can come in again.
Oh, okay.
If you think the rating is off, you can request a QME exam, and their opinion carries a lot of weight.
So they can be the tiebreaker in those situations.
Exactly.
This whole system is so much more complex than I realized before we started this. Wow.
It can be a lot to take in, but the more you understand it, the better prepared you'll be.
Speaking of being prepared, you mentioned earlier that, the employer gets to choose the first PTP if they have an MTN. That seems like it could be a problem.
It's definitely a point of debate, Some people say it's a conflict of interest.
Yeah, because the employer, they have a financial stake in the case.
Exactly.
Yeah.
And they might pressure the doctor to like clear someone for work too soon or downplay how bad the injury is.
Yeah, that's scary. It's supposed to protect the employee too, right?
It is, but it's a balance.
Finding that sweet spot between protecting workers and, managing costs for businesses.
Right. And that's why it's so important to know your rights, and how the system works. That way you can advocate for yourself.
Make sure you're getting the care you need.
Exactly.
All this talk about, injuries and disability is making me think about the mental and emotional side of things too.
Oh, that's such an important point.
It's not just about the physical injury, right? Like imagine getting hurt on the job, maybe even experiencing something traumatic.
Yeah, that can be really tough.
You'd probably feel anxious, depressed, maybe even PTSD.
Absolutely.
Yeah,
And those feelings can, they can affect your recovery.
I bet. It probably makes it harder to do physical therapy or just cope with the pain.
Right. It's all connected. So thankfully, the workers' comp system does recognize that,
Good.
yeah, injured workers are entitled to psychological treatment if it's deemed necessary.
That's reassuring to know. So they could see a therapist or a psychiatrist.
Exactly. Someone who specializes in, work-related injuries.
So they can help with coping mechanisms, managing anxiety, all of that.
Yeah, it's about supporting the whole person, not just the physical injury.
It's so important to remember that, healing, it's not just about fixing the physical injury.
Absolutely. It's about the mental and emotional well-being, too.
Yeah, having that support can make a huge difference in getting back to work and, just getting back to life.
Definitely.
Wow, this deep dive has been incredibly insightful.
We've covered a lot of ground, that's for sure.
Yeah, all those different doctors, the disability ratings, the psychological impacts. It's a lot to take in.
It's a complex system, but hopefully now our listener, they feel a little more prepared.
Yeah, knowing what to expect, understanding the different players, that can make all the difference.
Absolutely. It's all about empowering yourself with knowledge.
So before we wrap up, I want to leave you with something to think about.
Okay.
We talked about how the system, tries to protect both employees and employers, right?
Right.
But what about those unintended consequences?
Yeah, those are always a possibility.
Like those rules against self-referrals.
Mhm.
They're supposed to prevent conflicts of interest, which is good.
Yeah.
But could they also make it harder to get specialized care, especially if you live in a, rural area with fewer options.
That's a good point. It's something to consider.
Like what works for one person might not work for another.
Exactly. It's all about, understanding the nuances and making the best choices for your own situation.
And advocating for yourself,
Right.
knowing what you need and asking for it.
Definitely. The more you know about the system, the better off you'll be.
Exactly. All right, so that wraps up our journey through the world of California's workers' comp system.
We've demystified those roles, those regulations. Hopefully it's all a little less intimidating now.
And remember, you're not alone in this. There are resources out there to help you every step of the way.
Don't be afraid to reach out and ask for help if you need it.
Great advice. Okay, well, that's it for today's deep dive. We'll see you next time.